Okay, dysfunction of the trachea, again, obstruction, loss of filter function, common themes. Some causes of tracheal obstruction, so tracheal hypoplasia in brachiocephalics, and tracheal collapse in older small toy dogs, especially little pudgy ones, little honking cough. You can hear these guys before you see them. So this is tracheal collapse. You get laxity of this dorsal ligament, and the trachea kind of like makes a pitas on itself. Tracheal hypoplasia, by contrast, trachea is too small, and the rings often overlap. So normal trachea is like this, and then you have the dorsal ligament going across. Hypoplastic trachea is like this, and these rings actually rub on each other, and you get a little bit of squamous metaplasia. Neoplasia, similar to larynx, primary tracheal neoplasia is uncommon. There is this one, the equine granular cell tumor, which can form in the trachea and bronchi and cause significant obstruction, but pretty rare. People probably not see it. I've never seen one in real life. And then tracheal parasitism, fun one. So often incidental, but if you have very high loads, they can cause physical obstruction. So gapeworm in chickens is named for the fact because chickens are gaping for air. They have their necks out and they're like, I forget they have worms in my tongue. The tracheal worm in canines, we see this sometimes in wild wolves, but again, these often don't cause any symptoms. Just hanging out. Trachea, similar responses to the larynx. So ulcerative and fibronecrotic inflammation, very common. Here's that fibronecrotic membrane. It's starting to peel off in chunks. Yeah, you could just like pick that off. It's like cheese on a sandwich that's gotten cold. It's like melted, but now it's cold. It's like, I like food metaphors. Spiral inflammation. So that's mucus, mucousy inflammation. This is kind of the stereotypical response of the upper airway, especially the trachea, to any kind of irritation. So this is sort of non-specific, but we do see it a lot with parasites. So here's an example of tracheal parasites, and you can see all this mucus in here. That's just a response to the irritation parasites. Granulomatous, same things that cause granulomatous in other tissues, and then fibrosis. This can be a result of chronic inflammation, the resolution phase, and also post-surgical. So if you do a tracheostomy, stomy is stoma, it means a hole, so make a hole in the trachea. And importantly, fibrosis in the trachea can result in stricture, which can result in airway obstruction. So you have to be very careful here. Potential of inflammation or surgery around trachea is stricture. And then loss of filter function. So anything that decreases mucociliary appearance. So that's going to be things that injure either the epithelium itself or the cilia of the epithelium, or it changes the quality of that mucus layer and doesn't allow it to trap particles. So ciliary impairment is a big cause. There are 3 specific infectious causes that I would like you guys to know. So these are the bacteria that think they're cilia and they want to be cilia: respiratory, ear, reproductive. Those are the 3 sites to think about these. So joints also. So mycoplasma, bordetella, cardicells. Think they're cilia. So these are the guys that interfere with cilia function. You can also have chemical interference, so certain air pollutants, exposure to ozone. Ammonia is a really important one for animals because ammonia levels increase in dirty cages and enclosures. So predisposed to respiratory disease if you're not keeping your pens clean. And then things that change the mucus viscosity. Yeah.
I'm sorry, would you be able to repeat? You said respiratory, reproductive.
Respiratory, repro, and ear. Inner, middle ear. Places you have cilia. And joints. Yeah, mycoplasma lines and joints. There's cilia in your joints. Okay, so things that change your mucus viscosity, dehydration, cold. So this is the, don't go out when it's cold, you'll get a cold. Kind of true because cold interferes with your mucus viscosity, makes you slightly more susceptible. Inflammation, if you've got exudate in your mucus, it's going to change the quality. And then inherited disorders of cilia. So these are called ciliopathies or ciliary dyskinesias. Dys meaning abnormal, kinesia meaning movement. So your cilia don't move right. And these result in recurrent infections, especially respiratory and middle ear, because that's where you have cilia, and infertility, because you have cilia in your reproductive tract. So anybody know what situs inversus is?
On the wrong side.
Yeah, you can figure out from the words, right? Inverse, in situ, inverse. So your organs are backwards. In 50% of animals. Cool. So if you get an animal with recurrent infections and infertility, you should do a whole body animalogram on the X-ray and see if they work backwards, just for fun. 50% chance. Yeah.
Can you repeat again? Was it 50% of the animals with that have the inherited
50%
disorders?
of animals with these inherited ciliary disorders also have situs inversus. It's like the least important thing I've said today. Yeah. It's like, yeah, backwards, literally flipped. So your heart is on your left side, their heart is towards their right side. No, it's not a problem that their organs are backwards, unless you're like trying to do a heart stick and you're like, why am I getting air? Okay, so structure of the lower airway, I'm so behind. You have several different zones. Conducting means there is no respiratory function going on in the conducting zone. So that's your whole upper airway, the lower 2/3 of your trachea, and your main bronchi. So it's mostly ciliated epithelium. It's a lot of mucus cells and it's a lot of smooth muscle, but it is not breathing. This part has cartilage. Transitional, that's where you lose your cartilage. There's a star here for a species that does have transitional, or that does have cartilage in its transitional and lower airways. Who might need cartilage to keep their small airways open? Birds, no. Snakes. Horses, no. Snakes, no. Who's under a lot of pressure? Do fish have lungs? Guys. Marine mammals, seals and sea lions have cartilage in their lower airways. You guys write down like the least important. The sea lions have cartilage. Just a fun fact, not super important. It's important for them because they can dive to very deep pressures without their small airways going like yours would if you tried to do that. So this is down in your bronchioles, and it's transitional because we're starting to get into the respiratory epithelium, but not quite. We've lost cartilage. So this is the area between your conducting and your exchange. So exchange zone is where you're actually breathing. That's your alveoli. Structure of the lower airway, super important. The alveolar wall is very thin. It is made up of these components. Your type 1 pneumocytes are big flat guys, and they make up most of the surface, the breathing surface. Your type 2 are bigger cuboidal guys. You will not have to identify them, but these are the ones that produce surfactant, which helps with the surface tension in the lung to keep your alveoli open. If you think about a balloon, if you have a balloon that you fill with water and then dump all the water out, and then you're trying to blow up that balloon and deflate the balloon, what happens when you deflate the balloon all the way to the walls? They stick together, right? You do not want that in your alveoli. So a little bit of surfactant in there keeps them always a little bit open, because this is really hard to unstick from an alveolar perspective. From a balloon, not so much, but your lung is millions and millions of these tiny balloons, and if they're all stuck closed, it's going to take a lot of work to pop them back open. So surfactant keeps them always a little bit open. The type 2s, so they're less common, but these are also the progenitor cells for the rest of your alveolar epithelium. So with injury, you'll lose these type 1 guys, and these type 2 guys will proliferate. It's also composed of capillary endothelium, couple interstitial fibroblasts, and then alveolar macrophages that kind of wander around in the alveoli looking for dirt, bugs, things to eat. Okay. Vascular supply to the lung. There's a dual blood supply in the lung. So the pulmonary blood supply is, I call it the lung's job. So it's receiving deoxygenated blood from the pulmonary artery. It's oxygenating the blood and then returning it to the heart so it can go to the circulation. So that's the lung's job. And then the lung is only getting deoxygenated blood from that. So it also needs food supply. So that's the systemic or the bronchial circulation. And that's oxygenated blood coming in through the bronchial arteries. And then there are lymphatics in the lung. They are not prominent, primarily in the interstitium. All right, so lower airway function is conduction of air a little bit, primarily gas exchange is the big function in lower airway, and then clearance of particles and pathogens if the upper airway has not done its job. Right, so defense mechanisms in the lung. Some species have lobular divisions. So you have a lung lobe, right? And then within a lung lobe, you have lobules. So if you look at my mouse here, I'm outlining lobules. It's where all these very thick septa are. These are highly abnormal. But if you look over here in the more normal lung, you can see it's divided into little sections. See that? So those are lobules. These are well developed in people, pigs, and cows. There are no lobules in dogs, cats, rodents, and rabbits, and kind of intermediate in horses and small ruminants. The function of these is to slow or stop or contain the spread of inflammation. So if I have really severe inflammatory disease over here, I'm going to try to contain it to a lobule. So that's why all these divisions here. And you can see it's kind of worked, right? You can pretty well outline where the inflammation is and where it stopped. And it seems to involve full lobules, but then next to it, there are full lobules that are not affected. So that's kind of a strategy that primarily large animals have to limit the spread of inflammation. You also have mucus and surfactant production, alveolar macrophages we've already talked about, and then bronchus-associated lymphoid tissue. So we talked about gult in the gut, I hope. This is bulk, same thing, different ways. And then you do have leukocytes that circulate through your bloodstream again. So here's your BALT. It's also called MALT, which is just mucosa-associated lymphoid tissue. So BALT and GALT are both MALT. Makes sense. Okay. Failure of filter function in the conducting zone. So in that kind of upper part, lower trachea, it's similar to in the upper airway. One specific change that you can get in the lower airway is bronchiectasis. So that's a permanent dilation of your bronchi. This can be caused by chronic obstruction above the dilation, chronic inflammation that causes weakening of that bronchiolar or bronchial wall, or severe bronchial disease like in feline asthma. We often see dilation, and that's due to the inflammation. So here are some photos of bronchiectasis. Here's a cross section. You can actually see how big they are in cross section. And here are two that the bronchioles are actually filled with pus. So here you can see all these little pus pockets. These used to be bronchioles. Take my word for it. It's hard to tell them from abscesses at this point. But if you look around, you can see there's some cartilage around here. These are all little airways. Another sign that you might be dealing with bronchiectasis and bronchiolar inflammation is in this lower picture. Can you appreciate how all these lesions are kind of in a line, sort of, maybe, kind of along a track? Use your imagination. Yes, Dr. Ames, I see it. So this is following a bronchial tree. It's similar to when you see something that's following the biliary tree. Lesions kind of like line up a little bit in these like serpiginous snake-looking trails. It's kind of like that. You have to kind of use your imaginoscope a little bit, but it's following the bronchial tree. So here's an example of alveolar prognosis in a cat. So this is failure of macrophages to clean up surfactant. properly. So either you have a macrophage defect or there's something abnormal about your surfactant and your macrophages cannot digest it. So this is a case report. Here's a sample of this animal's BAL fluid. It's bronchoalveolar lavage. So they actually go in, they squirt water down there and suck it back up and see what they get. This is what they got. It's cloudy and full of cells. Ew. So high protein content, lots of cells. And here's the lesion. So this is a normal histomicrograph of a lung. And this is what this cat's lungs look like. So these are all the alveolar spaces. This is a bronchus right here coming down. So we're in the conducting, transitional, and here we're into alveoli. This animal's alveoli are full of pink stuff and cells. So high protein fluid, lots of cells, mostly surfactant. Okay, so lower airway responses to injury, failure of air conduction. You can get this a couple ways. First way is by increasing the resistance of the lung. Resistance is the amount of work required to move air in and out of the lung. So things that increase resistance are going to be obstruction of your airways or constriction of your airways. Constriction, also obstruction. But those are kind of the flavors. The other way you can reduce air conduction is to decrease compliance. And that's the work required to actually expand your lungs and open your alveoli. So this is, compliance is decreased by things that increase the stiffness of the lung. So primarily fibrosis. Pulmonary fibrosis is common in multiple species. There are several kind of idiopathic syndromes. There's also a viral induced pulmonary fibrosis in horses that we'll talk about on Horse Day, which I'm very excited for. Another common cause in humans and in animals born prematurely is altered surface tension in your alveoli. So if your balloon is stuck closed and you don't have surfactant, low compliance. So you have to do a lot of work to open that. So that's why newborn preemie babies can't breathe, because they can't hold their alveoli open. Yeah. Okay, and then probably the most important one, failure of gas exchange. So this is very nonspecific, can be caused by anything that interferes with that gas exchange membrane. So hemorrhage, fluid, atelectasis, we haven't talked about yet, but that's collapse of the lung and loss of air from the lung. Emphysema, which is the opposite. It's too much air in a part of the lung and you actually get tearing and formation of these big bolus spaces. And then pneumonias, we will spend a lot of time talking about pneumonia. Important point about the lung, the reserve capacity of the lung is about 80%. So if you're looking at purely from a gas exchange standpoint, you can lose 80% of your lung and still have enough lung to breathe and oxygenate your tissues. Super important when we talk about pneumonia, because pneumonia kills you with way less than 80% involvement, but it's not because you can't breathe, it's because you're sucked. Okay, looks like it's about quitting time, but let's look at these normal lungs in preparation for what is to come. So bovine, equine, porcine, you can kind of pick out the lobules from this mag, although not well. You can see these little, see how it's kind of divided into like chunks versus a feline lung, not so much. Avian lung, totally weird, not anything like a mammal lung. So their lungs are not expandable and collapsible. So ours work like our lungs are bellows. A bird has air sacs that act like bellows, and their lungs are stiff and stable, and the bellows just continuously pump air through their lungs. So their lungs do not collapse when you open the chest cavity. And this is actually the dorsal surface. Bird lungs are tucked way up under their ribs. So these lines right here are where the ribs and spine were. So they're way up there. Turtle has more primitive lungs, but kind of similar. They're tucked up there where bird lungs would be.